Welcome to our medical quiz channel that deals with physical and mental health information.
This quiz is for educational and entertainment purposes only. It is not medical advice, diagnosis, or treatment. If you have health or mental health concerns, please speak with a qualified healthcare professional. Welcome to Quizzabay. Test your knowledge about celiac disease, symptoms in women, diagnosis, gluten-free foods, and what happens after eating gluten with this 15-question medical quiz. This quiz is educational and is not medical advice. Question 1. What is celiac disease, an autoimmune disease triggered by gluten? Option A. A short-term stomach upset from eating too much wheat. Option B. An immune reaction to gluten that can damage the small intestine. Option C. A gluten sensitivity that causes symptoms but no intestinal damage. Option D. A digestive problem caused only by low stomach acid. Choose the right answer. Correct answer. Option B. An immune reaction to gluten that can damage the small intestine. Mayo Clinic says celiac disease is an autoimmune condition where gluten triggers damage in the small intestine. Question 2. According to the Office on Women's Health, celiac disease affects about how many Americans? Option A. About 300,000 Americans. Option B. About 30 million Americans. Option C. Only a few thousand Americans. Option D. About 3 million Americans. Choose the right answer. Correct answer. Option D. About 3 million Americans. The Office on Women's Health says celiac disease affects 3 million Americans, and more than half are women. Question 3. If someone searches "Have I got celiac disease quiz," what symptom group is most relevant? Option A. Bloating, long-term diarrhea, constipation, belly pain, fatigue or weight loss. Option B. Heartburn after spicy foods, mild burping and quick relief with antacids. Option C. Brief bloating only after overeating, with no ongoing bowel changes. Option D. Stomach cramps only after dairy, with no gluten-related pattern. Choose the right answer. Correct answer. Option A. Bloating, long-term diarrhea, constipation, belly pain, fatigue or weight loss. Mayo Clinic and MedlinePlus list digestive symptoms plus fatigue, weight loss, and other body-wide symptoms. Question 4. Which symptom of celiac disease in women is listed by the Office on Women's Health? Option A. Temporary bloating only during one heavy meal. Option B. Heartburn after fried foods but no other symptoms. Option C. Missed menstrual periods or infertility, trouble getting pregnant. Option D. Mild stomach rumbling that stops after drinking water. Choose the right answer. Correct answer. Option C. Missed menstrual periods or infertility, trouble getting pregnant. The Office on Women's Health lists missed menstrual periods, infertility, and miscarriages among possible issues. Question 5. Is celiac disease the same as gluten intolerance? Option A. No, gluten sensitivity can cause symptoms but does not damage the small intestine like celiac disease. Option B. Yes, both always damage the small intestine equally. Option C. Yes, both always require a positive small intestine biopsy. Option D. No, gluten intolerance always causes only constipation. Choose the right answer. Correct answer. Option A. No, gluten sensitivity can cause symptoms but does not damage the small intestine like celiac disease. MedlinePlus says gluten sensitivity can share symptoms, but it does not damage the small intestine like celiac disease. Question 6. Can celiac disease cause constipation? Option A. No, it can only cause diarrhea. Option B. Only after someone starts a gluten-free diet. Option C. Yes, constipation can be one possible digestive symptom. Option D. Only when gluten causes immediate vomiting. Choose the right answer. Correct answer. Option C. Yes, constipation can be one possible digestive symptom. Mayo Clinic and MedlinePlus both include constipation among possible celiac disease symptoms. Question 7. Which non-digestive sign can happen with celiac disease? Option A. Low iron only from not eating enough red meat. Option B. Only a mild stomachache after wheat. Option C. Bloating that lasts one afternoon only. Option D. Iron deficiency anemia, low iron in the blood. Choose the right answer. Correct answer. Option D. Iron deficiency anemia, low iron in the blood. Mayo Clinic and Women's Health list iron deficiency anemia as a possible non-digestive sign. Question 8. What can happen if someone with celiac disease eats gluten? Option A. The immune system can attack the small intestine lining and harm nutrient absorption. Option B. Gluten only causes gas in the stomach but cannot affect nutrients. Option C. The gut becomes tolerant to gluten after repeated small servings. Option D. Only the colon is irritated while the small intestine stays unaffected. Choose the right answer. Correct answer. Option A. The immune system can attack the small intestine lining and harm nutrient absorption. Mayo Clinic says gluten exposure can damage villi, tiny nutrient-absorbing projections, and cause malabsorption. Question 9. How is celiac disease diagnosed? Option A. By digestive symptoms alone, without blood tests or tissue checks. Option B. Usually with blood tests and sometimes a small intestine biopsy, tiny tissue sample. Option C. Only by trying a gluten-free diet for 1 weekend. Option D. Only by checking for stomach acid levels. Choose the right answer. Correct answer. Option B. Usually with blood tests and sometimes a small intestine biopsy, tiny tissue sample. Mayo Clinic and MedlinePlus describe blood tests and biopsy as common tools for diagnosis. Question 10. Why should testing happen before starting a gluten-free diet? Option A. Because gluten-free foods always make intestinal damage worse. Option B. Because symptoms always disappear permanently after one gluten-free meal. Option C. Because celiac testing works best after avoiding all grains for months. Option D. Because removing gluten can make blood tests look normal and harder to interpret. Choose the right answer. Correct answer. Option D. Because removing gluten can make blood tests look normal and harder to interpret. Mayo Clinic says eliminating gluten before testing can make blood test results appear in the standard range. Question 11. What is the main treatment for celiac disease? Option A. A strict lifelong gluten-free diet. Option B. Digestive enzyme pills so wheat can be eaten normally. Option C. Eating small amounts of gluten to build tolerance. Option D. Avoiding only sugar while continuing wheat and rye. Choose the right answer. Correct answer. Option A. A strict lifelong gluten-free diet. Mayo Clinic says a strict, lifelong gluten-free diet is the only way to manage celiac disease. Question 12. Which foods usually need to be avoided with celiac disease? Option A. Plain fruits, vegetables, and eggs. Option B. Wheat, barley, and rye. Option C. Rice, corn, and potatoes. Option D. Fresh fish and plain poultry. Choose the right answer. Correct answer. Option B. Wheat, barley, and rye. Mayo Clinic and Women's Health list wheat, barley, and rye as gluten-containing grains to avoid. Question 13. What can people with celiac disease eat? Option A. Only packaged gluten-free desserts. Option B. Any bread if the serving is small. Option C. Fresh meats, fruits, vegetables, potatoes, rice, corn, and quinoa when gluten-free. Option D. Barley and rye if eaten with vegetables. Choose the right answer. Correct answer. Option C. Fresh meats, fruits, vegetables, potatoes, rice, corn, and quinoa when gluten-free. Mayo Clinic lists many naturally gluten-free foods, including fruits, vegetables, potatoes, rice, corn, and quinoa. Question 14. Can celiac disease develop later in life? Option A. No, gluten-related intestinal symptoms can only begin in childhood. Option B. No, adults can only have gluten intolerance. Option C. Yes, symptoms can appear in adults and vary widely. Option D. Only after years of untreated lactose intolerance. Choose the right answer. Correct answer. Option C. Yes, symptoms can appear in adults and vary widely. MedlinePlus says symptoms vary and some people may not notice symptoms. Adult symptoms can differ from children. Question 15. Is celiac disease genetic or inherited? Option A. It is never related to family history. Option B. It is passed only through diet habits, not genes. Option C. It develops only from eating too much bread. Option D. It can run in families, and risk is higher with a close family member. Choose the right answer. Correct answer. Option D. It can run in families, and risk is higher with a close family member. Women's Health says celiac disease is genetic and risk is higher with a close family member such as a mother or sister. Check your score. 0 to 5, keep learning and try another quiz. 6 to 10, good effort. 11 to 15, excellent score. The trusted medical sources used for this quiz are listed at the end of the video description. You can visit those links to learn more from the original authority sources.
Thanks for watching. Please like and subscribe. Remember, this is not medical or psychiatric advice.